Good morning, Temple College. My name is Taylor Ratcliffe. I'm an emergency physician here in Central Texas, and I'm the EMS Health Professions Program Medical Director. So I want to talk to you this morning about why you should go ahead and get the COVID vaccine. Now let me say, some of you have already gotten the vaccination, and thank you for that. I want you to take heart in the fact that millions of Americans have received the COVID-19 vaccine, and millions more across the globe have done the same thing at this point. There is a very robust system, the VAERS system, the Vaccine Adverse Event Reporting System, that is designed to track adverse events and problems with the vaccinations. I know a lot of you have gotten vaccinated and went back home, and you may not have felt very good. You may have had body aches, headache, fatigue, malaise. You may have actually said, gosh, I wish I didn't get that. But I actually want to congratulate you, because that was the sign of your immune system building a very robust response to the vaccine and bolstering your immunity to the COVID-19 virus. So I do want to encourage you that it is safe and absolutely appropriate to go ahead and get that vaccine if you haven't done so. If you had concerns about a novel type of vaccination, you may have heard the messenger RNA vaccines. Johnson & Johnson is out with a relatively common type of vaccination similar to what we would get for the flu shot. So if that technology concerned you, there's an alternate out there. You may also have heard about a lot of problems with the Johnson & Johnson vaccine and things related to blood clots. Again, when you look at the numbers and you follow the science, those adverse events are extremely rare and very uncommon. So if you have concerns, if you have other health issues, talk with your doctor about this. Get other opinions from healthcare professionals and people who can give you true information and good advice, and make a personal choice for yourself, but I hope it's to go ahead and go get vaccinated. So many of you out there are relatively young and healthy students at Temple College. A lot of you are in the healthcare professions programs. So you may be asking yourself, well, why do I really need to get vaccinated? For me, getting infected with COVID-19 is really not that big of a risk. And generally speaking, you're right. I will tell you, though, that there are people out there who are susceptible to COVID-19 for odd reasons that we don't generally understand yet. Unfortunately, I've had to take care of young people in their 20s and 30s in the hospital who've needed to be admitted on high-flow oxygen, some even put on ventilators. Speaking of the numbers, you're pretty safe, but it's a good idea to go ahead and get vaccinated for a number of reasons. One is, why take the chance if you might be that person or not who's susceptible to COVID-19? Two, as a future healthcare provider and a person who is probably already interacting in the healthcare environment, we need to do our part to try and help create a barrier to infection for our patients. It is possible, even though you may not be that sick from COVID-19 infection, that you can asymptomatically spread that to your patients while you're on clinicals and other rotations. So again, do your part, do your research, talk to your doctor if you're concerned, get the information you need, and go get the shot.